Today we're going to talk about our horse health check and vital signs. My name is Deanna Zimmerman. This is my handler, and my horse is Star today. And so I'm going to go through all the things that you would need to do to check your horse's vital signs. The first thing I'm going to do is I'm going to tell you about the horse's general appearance. You want to look at their eyes. They should be clear and bright. You can also look at their skin coat. Obviously she's pretty shiny today, so you can tell that she's healthy because she's got enough nutrition. And next thing I'm going to show you is the mucous membranes. You can find these on the gums of the horse or in the conjunctiva underneath the eye. And so today I'm going to show you. You just want to pick it up, look at what she's got. I know. So she's got nice healthy pink gums today, and they're moist, so that means that she's hydrated. If she would have a brick red gums, that can mean that she's got fever and infection. If she were to have bluish gums, that can mean that she has lack of oxygen. If she has yellow gums, that can mean jaundice. And if she had white gums, it could mean that she's anemic or in shock. And if she also had dry gums, that can mean that she's dehydrated. The next thing I'm going to show is the capillary refill time. This, again, you would want to go to the gums to do this. So you're going to press for 1 to 2 seconds, and it should come back to normal. If it doesn't come back to normal pink, that could mean that she is dehydrated. The next thing I'm going to show you today is pulse. To take this, you can take it in 3 different spots on the horse. Under the jaw is the external maxillary artery, and then you can also take the radial pulse, which is below the knee, and the digital pulse, which is above the coronary band on the back of the foot. So today I'm going to show you the easiest way to take this, and it's on the external maxillary artery that runs underneath the jaw, and you just want to find it, and it will kind of move around a little bit, so you just want to kind of wiggle it back and forth. And once you find it, you want to press up against the jawbone, and you want to feel the pulses. So I have her pulses now, and I'm going to have my handler here count for 10 seconds, and we'll find the pulse. Okay, so I got 6. 6 times 6 is 36. So the normal range for a horse is 32 to 44 beats per minute. So she is in that range. And so the next thing we're going to go on to is the radial pulse, which we will show here. So you're going to find the radial pulse on the back of the knee, and you just want to feel for the pulse, and you would take it the same way as you did with the underneath the jaw. Next thing you're going to take is the digital pulse. This one you will not probably be able to find unless the horse would have a problem in their foot. But to take this, you want to go down here, and it would be in this nice little curve right here, and you would press down and feel for the pulse. Obviously, if she's healthy, she does not have a pulse there today. So the next thing I'm going to show you is the skin pinch. And to do this, you want to come up on the neck of the horse, and you want to grab a little bit of skin, tint it, and then let it go. If it goes back down between 1 to 2 seconds, that horse is hydrated. If it doesn't, that could mean that the horse is dehydrated, or it might be an older horse that has thinner skin. And for the next one, you're going to have to grab your stethoscope, and you just want to make sure that she knows that you're down. When you take the heart rate of the horse, you're going to put the stethoscope right behind the elbow of the horse on the horse's chest wall. This will help you hear the heartbeat, and so you would want this to fall between the 32 to 44 beats per minute, just like the pulse. They should be exactly the same. So right now I'm going to listen for her heart rate, and I'm going to have you time again. you might have to move around a little bit to find the heart rate. Okay, I got it.
Stop.
Okay, so I got 6, so just like before, 6 times 6 is the 36. And so her heart rate and her pulse are the same. The next thing we're going to do is we're going to look for the gut sounds on the horse. And to do this, you want to face backwards so you can see if she's going to kick you or anything like that. And so you're going to press your ear up to the top quadrant and listen. And she's got nice gut sounds, are consistent. And you want to do this on both sides of the horse. So she has very consistent gut sounds, so she's healthy today. If she were to have no gut sounds, that can mean colic. If she had like rushing gut sounds or hypermodal, she could be having diarrhea or stomach upset or something like that. The next thing I'm going to do is I'm going to do her respiratory rate. To do this, you want to watch the flank of the horse. And as you can see, the horse breathes in and out, and that's one motion. You don't want to count both of those, so you just want to count either when it comes out or when it goes in. So I'm going to have my handler again time for 10 seconds, and I will then show you how many breaths per minute she had. Okay, so I'm going to watch her breathe now, and my handler's going to time for the 10 seconds, so you can go now.
Time.
Okay, so I had 2 breaths in that time. 2 times 6 would be 12, and that would fall into the range of 8 to 16 breaths per minute. And so we can go on to the next thing, and this will be temperature. So for this, you want your digital, or you can go old school and do your mercury thermometer. If you have the mercury thermometer, you want to shake it down below the 80-degree line. I'm going to use the digital today because it's a little easier. And you want to coat the end in some Vaseline so then it doesn't hurt when it goes in. And you're going to come up to your horse and make sure that she knows that you're here. Okay, so you want to make sure the horse knows that you're here. Once you get back here, you want to grab her tail gently, push it to the side a little bit, and you're going to insert the thermometer, and you want to push it up against the wall so then it's not stuck in the poop, because that will give you a false reading. And then you want to gently pull it out, and this thermometer reads 100 degrees Fahrenheit. The range can be 99.5 to 101.5, so she falls within that range. And then afterwards, you want to clean off your thermometer, and you can also use a little alcohol to sterilize it for the next use. And then that's it. So today we went over the vital signs of the horse, and I thank you for watching this.